Hey, renal care warriors. Ever seen a patient with flank pain, high blood pressure, and kidneys that look like they've ballooned on imaging? You might be looking at polycystic kidney disease, or PKD, a genetic disorder that leads to progressive kidney enlargement and often renal failure. Today we'll explore what causes PKD, how it presents, and how nurses play a key role in managing symptoms and educating families about long-term care. What is PKD? PKD is a genetic disorder where clusters of fluid-filled cysts develop primarily in the kidneys, causing them to enlarge, lose function, and scar over time. There are two main types: autosomal dominant PKD, or ADPKD, most common with 90% of cases. Symptoms usually appear between 30–50 years of age. Each child has a 50% chance of inheriting the condition. Autosomal recessive PKD, or ARPKD, rare severe form, presents in infancy or early childhood, often associated with liver fibrosis and poor prognosis. Common symptoms and complications: flank or abdominal pain, hypertension, often early onset, hematuria or blood in urine, recurrent urinary tract infections or UTIs, abdominal distension or palpable kidneys. Complications may include chronic kidney disease, end-stage renal disease, kidney stones, liver cysts, aneurysms, especially cerebral, screen if family history, heart valve abnormalities. Medical management, blood pressure control, use ACE inhibitors or ARBs to protect renal function, target BP, less than 130/80ths mmHg, pain management, acetaminophen for mild pain, avoid NSAIDs due to nephrotoxicity, surgical cyst drainage for severe persistent pain, renal monitoring and preparation, monitor GFR, BUN, creatinine, plan ahead for dialysis or kidney transplant as disease progresses. Tolvaptan may slow cyst growth in ADPKD, monitor for liver toxicity, manage complications, treat UTIs promptly, monitor for signs of ruptured cysts, bleeding, or aneurysms. Nursing priorities: symptom management, monitor and document pain level, BP, urinary output, encourage adequate hydration unless restricted, address fatigue and mobility limitations. Fluid and electrolyte balance. Monitor labs for hyperkalemia, acidosis, and declining renal function. Educate on low-sodium diet and fluid restriction when appropriate. Prepare for renal replacement therapy. Teach about options: hemodialysis, peritoneal dialysis, transplant. Coordinate with nephrology and transplant teams. Patient and family education. Emphasize genetic counseling for family members. Discuss disease progression and early symptom reporting. Provide emotional support for long-term coping and planning. Bottom line, support the kidneys, empower the family. PKD isn't just a kidney condition, it's a lifelong journey for patients and their families. Nurses are key in helping them manage symptoms, prevent complications, and prepare for the future. What's your top tip when caring for patients with genetic kidney diseases? Share it in the comments. Like, subscribe, and follow for more renal nursing insights, because education is the first step toward empowerment. Nurses are key in helping them manage symptoms, prevent complications, and prepare for the future. What's your top tip when caring for patients with genetic kidney diseases? Share it in the comments. Like, subscribe, and follow for more renal nursing insights, because education is the first step toward empowerment.